Hi Amy, I am Shannon. I'll be doing your abdominal exam today. And do you consent to allowing me to upload this onto YouTube as an unlisted video for my teachers to grade?
Yes, I do.
Alrighty. If you would like to lay down and make yourself comfortable, I'm just going to adjust the camera so you can see. Alrighty. Thank you so much for pulling up your shirt. So I will be assessing her abdomen right now. I'll be assessing the contour of her abdomen, whether it's rounded, flat. I'll assess the skin color, whether it is white, pale, jaundice. I'll assess also her sclera in her eyes. I'll take a look at those to see if they are yellow or jaundice or anything like that. I'll also be assessing for any rashes or lesions, some striae. I'll assess also for vascular pulsations, as well as for any type of peristalsis that I can see. And then next I will be auscultating her abdomen with my stethoscope, and I will be auscultating for a gurgling sound between 5 and 30 per minute is within normal limits. And I will start on the right lower quadrant and move up and around to the right upper and the left upper and the left lower quadrants. So I'll go ahead and start my assessment, and I'll warm the stethoscope before I place it on her abdomen. And I'm just listening for gurgling sounds in the right lower quadrant, moving up to the left right upper quadrant, the left upper quadrant, as well as the left lower quadrant. And there is gurgling sounds in all 4 quadrants, is within normal limits. I'm also going to be listening for the aorta artery, as well as the iliac arteries, the renal arteries, and the femoral arteries. And I will be listening for any bruits that would indicate that she has atherosclerotic plaque forming, and that would require further a follow-up. But I will go ahead and take a listen. And the aortic artery is right above the umbilicus. So I'll take a listen with both the bell and the diaphragm of my stethoscope, and make sure that there's no bruits. And I'll move down to the iliac arteries as well, make sure that there's no bruits that I hear. And then I'll move over to the renal arteries. I do not hear anything. It's all within normal limits. And then I will also listen to the femoral arteries, normally on bare skin, but we're just going to go ahead and take a listen with the pants on. We'll take a listen, and I do not hear any bruits at this time. It's all within normal limits. Alrighty. Next, I will be percussing her abdomen, and I will be listening for tympanic or dole sounds. Tympanic would be over hollow organs, and dole sounds would be over organs that are like your liver and your spleen, so solid organs. So I'll start again in the right lower quadrant, and I'll be tapping my finger to listen to the percussions. And I will move all around to the right upper, left upper quadrant, and the left lower quadrant. And I do hear tympanic sounds. So everything is within normal limits. I will go ahead and assess for her liver and the borderline of her liver with percussions. And I'm going to start with the midclavicular line close to the umbilicus, and I'll work my way up until I hear some dullness. Alrighty, and when I hear that dullness on the liver's border, I'll go ahead and take my my pen, and I will mark that area. And then I will assess the upper part of the liver and in between the intercostal spaces. And once I feel the liver's top border, I will go ahead and measure that and make sure it is within 6 to 12 centimeters. And that is at 6 centimeters, so this is within normal limits, and her liver does not appear to be inflamed in any way. I will also percuss for her spleen on the left side. And usually the spleen is located underneath the ribs, so I should not hear any type of dullness. And I do not hear any dullness. It's all tympanic. So her spleen does not appear to be inflamed either. I will also take a listen and percuss for her urinary bladder, and it will be right above the pubic bone. So I'll go ahead and percuss. tympanic here. And if her bladder was full, I may hear some dullness right above the pubic bone, but it is not full at this point, so it's all tympanic. And then next, I will begin to do a very mild palpation, a very, not deep, but shallow palpation. And I'm going to be palpating for any kind of masses, any type of tenderness, or anything like that. So Amy, if you feel any tenderness, please let me know. So I'm going to start in the right lower quadrant and just lightly palpate to the right upper quadrant, the left upper quadrant, and the left lower quadrant. Do you feel any tenderness? All right, and I'll go ahead and start my deep palpations. So I'm going to deeply palpate for any tenderness or masses in your abdomen, anything abnormal. And do you feel any tenderness or anything like that? And then I will have her breathe in deeply so that I can palpate the border of her liver. So go ahead and take a deep breath, Amy. And I'll palpate kind of for the border of her liver, which is, I do feel. And it does not feel enlarged or anything abnormal. And then I'll also try to palpate for her spleen as well. Go ahead and give me a deep breath, Amy. All right, and as I'm palpating, I do not feel anything, which is a good sign. It means that the spleen is not enlarged. And so next, I will be doing a palpation for something called Murphy's sign, which is palpating for any cholecystitis. So if there's any inflammation in the gallbladder, she's going to feel a lot of pain right underneath the liver area. So I'm going to go ahead and do a deep palpation. And Amy, if you feel any tenderness, please let me know. Any tenderness? Alrighty, and so that is the Murphy's sign. I will go down to the sign to test for appendicitis. It is called rebound tenderness. And I will be palpating right in between the umbilicus and the anterior medial iliac spine. And so when I'm going to go ahead and palpate deeply and then release quickly. And if she feels any pain, either with palpation or release, it could mean that she may have appendicitis. It's also called McBurney's point, in between the umbilicus and the iliac crest here is McBurney's point. And if it is tender, that it could mean that there is some appendicitis going on. I will also assess for any ascites with any patients that do have ascites. This is called the tidal wave test, where if Amy places her hand in the middle of her abdomen, and I'll take the right side of her abdomen, normally when a patient's supine, the ascites moves to the back of their body. And so with this test, I'm going to push on the right side of her body and towards the back. And if there's a wave of fluid that shifts to the left side, that's called the tidal wave test. And that is to test for ascites. There's also another test called the dullness test. And it is where when you percuss lower down, you'll percuss from further down all the way across the abdomen to the other side. And if there is ascites, you'll hear a dullness on the back lower sides of the abdomen, and you'll hear a tympanic over the top. And then next, we are going to assess for a CVA tenderness. So I'm actually going to have Amy sit up, and we're just going to adjust the camera. All right, I'm going to have her back facing us. And we're just going to lift her shirt again. So this is CVA tenderness, and I'm going to find where her kidneys would be. All right, and this is going to also, this is going to show, I'm going to have you actually turn this way a little bit. Okay, and this is going to show us if there's any kind of like kidney stones or anything, problems with her kidneys right now. But in order to test the CVA tenderness, I'm going to place my hand here and then where the kidney would be, and then just hit slightly. Do you feel any tenderness, Amy? Alrighty, I'm going to do the same to the right side here. Any tenderness? No. Alrighty, and that would assess for any kidney stones or any infections that may be in the kidneys. But that is the conclusion of our abdominal exam. Thank you.